Our second speaker today is Dr. Sandra Carrillo. Her topic is Medical Cannabis, a Physician's Perspective. And before I proceed, I'd like to preface by declaring that Dr. Sandra Carrillo is my spouse, invited by Brad Turner to appear. I have conducted hundreds of interviews and presentations, but interviewing my wife is a first even for me. As one of my good friends stated, you're one of the bravest men I know. Dr. Sandra Carrillo earned her medical doctorate degree from the University CES in Medellin, Colombia. She holds a master's degree in aesthetic medicine from Baleares Island University in Spain and completed a master's program of anti-aging and aesthetic medicine in Argentina, certified by the International Anti-Aging Society. Dr. Carrillo further holds a master's in health services management, Universidad Latina in Panama, which is essentially a specialized MBA. She is certified by the Pharmacology University and deemed an expert doctor in cannabis medicine, University of Puerto Rico. She completed the University of Toronto Faculty of Medicine CC.net cannabis training program for MDs twice, and I could spend the next 15 minutes describing her other qualifications. Dr. Sandra Carrillo is professor in charge of the Cannabis Research and Education Initiative, Faculty of Medicine, University of Panama. She is the president of the Colombian Medical Association of Cannabis Practitioners. And further, she is co-founder of Medican IPS, the second largest group of medical cannabis clinics and practitioners in Colombia, with 7 locations in counting. Sandra has spoken at over 50 events on 5 continents, including Canatech Panama, Digital Hollywood USA, Hemp and CBD Expo UK. She's appeared in Malta, Portugal, Colombia, Mexico, Brazil, Jamaica, Thailand, etc., etc. She's regularly invited to speak at specialized scientific conferences on a continuous basis. Usually MD, PhD type events. You know, I've listened in on a few of them, and I'm lost after the first 15. Moreover, Sandra has appeared on dozens of television and radio programs and makes regular podcast appearances. Sandra has guest lectured at the CES Medical School in Colombia, University of Sao Paulo, Brazil, and the University of Mexico, Mexico City, where she holds an honorary professorship. She was an expert witness presenting several oral and written submissions before the Government Health Committee responsible for drafting legislation to legalize cannabis for medical use in Panama. Her interests are primarily in research and education. She is a member of the ICRS, which is the International Cannabinoid Research Society, member of the SCC, Society of Cannabis Clinicians, board member of ACS, Association of Cannabis Specialists in the USA, and member of the IACM, International Association for Cannabinoid Medicine. And finally, her proudest achievements, Sandra is a co-founder of the Panama Food Bank and a volunteer at the Children's Epilepsy Foundation in Panama. Dr. Sandra Carrillo, welcome to the Investor Hot Seat.
Thank you so much, John. Thank you to Brad for inviting me. And it's an honor for me to be here and being interviewed by John. Thank you so much. I really appreciate this opportunity, since education for me is a very important subject. And I also consider that the industry and the doctors and healthcare practitioners, we are part of an ecosystem. So we need a healthy industry as doctors to be able to have very good quality products and medicines for our patients. So these events are very important because we need to have a healthy industry in order to be able to create good medications for the patients and products that are safe for the patient's consumption.
There we are. It's working. And so let's start with the following questions. How did you get into medical cannabis? What made you decide to include medical cannabis in your clinical practice?
That's a very good question, a very important one, because this is like the who marks the before and the after in my clinical practice. Before, I was, I wouldn't say a traditional doctor, because medical cannabis is not untraditional medicine. It's just medicine that is being used for thousands of years. But before, I was working more on ER and doing more consultation, prescribing medications that usually all doctors prescribe. But since I am a volunteer of children's epilepsy in Panama, I started seeing mothers having to fly to other countries to get medications, particularly CBD, to treat their children epilepsy. We have to remember that these years, the internet, everybody has access to internet. So since in Panama, medical cannabis is not legal, I was seeing all these mothers flying to the United States, to Colombia, to different countries to find treatment for these patients, and in this specific case, children. And I saw how these patients were improving. So that made me think about maybe that was an alternative. And then I flew to Canada, and that was where I did my first training. And when I saw this room full of doctors, like it was like around 300 doctors talking about medical cannabis, scientific evidence, endocannabinoid system. So that was my first approach years ago. And since then, I changed my approach to my patients, because I see now a patient more than a symptom, more than a disease. Is like a whole integrative approach that medical cannabis allowed me to do. And it's a more personalized medicine, which I feel very grateful to practice. Before, medicine has been automatized. The doctor is being required to see a number of patients every hour. So that don't allow the doctor to develop a good relationship with the patient. For the doctors that are practicing or prescribing medical cannabis, I think they will agree with me that we take the time to understand a lot of subjects regarding to the lifestyle of the patient, the quality of life. So I think medical cannabis allowed me to practice a more empathic medicine, more personalized medicine. So I feel very grateful, because since medical cannabis came into a clinical practice, I've been seeing the patients with a different perspective, more holistic and more personalized, which is very important, and the patients really appreciate all this time. So that's the way I started.
Great. Why shouldn't I just visit my local legal dispensary and buy directly from a bud tender? Why should I see an MD, ND, DO, or any other healthcare professional?
Well, that's an amazing question too, and you just say it, because in the case of a doctor studied medicine, knows the body, knows the drug-drug interactions, knows the side effects, knows how to catalog a pathology, and knows how to customize or prescribe the proper treatment for the patient. And that also includes what is the follow-up of the patients. And this is very important, because the doctor, first of all, when the patient comes to the visit to the clinic, the doctor has to do a very deep clinical history and put it on the records. And then, of course, the physical examination. So there is a lot of things that a doctor has to do before deciding to prescribe or recommend medical cannabis. So I think there is a big difference, and is it also depends in which country are you living. Particularly in Colombia, we don't have bud tenders. We just have the doctors, and medical cannabis is prescribed just by doctors. So it's very important for me, and I always say this to patients, don't self-medicate, because cannabis medicine is a very noble medicine, but as other medicine has some drug-drug interactions and some side effects. They are, of course, not lethal, but it's very important to have consideration. And the most important thing that I will always highlight is the drug-drug interactions. For a bud tender, it will be very hard to know the drug-drug interactions. So I think, of course, according to the country the person is living, I will always advise to visit the doctor first, because there is many things that had to be taken in consideration, and also to recommend the product that is safe and that is accurate for the patient's ailment.
Thank you. Based on your experience with patients, does access to medical cannabis improve lives?
Definitely, yes. That's 100% yes. And that is the part that I like most about medical cannabis or cannabinoid medicine, because I had the opportunity to see, and as I mentioned at the very beginning, we are not treating a symptom, we are not treating a pathology, we are treating a whole person from an integrative approach. So quality of life is something very important that we see improving in patients, in particular pathologies. I can mention just refractory epilepsy, multiple sclerosis, chronic pain, like being neuropathic pain, arthritis, fibromyalgia, or oncological pain, being different types of cancers that can produce pain. So we see how medical cannabis help these patients. Also talking about the nausea and vomiting induced by chemotherapy in patients. Definitely all these patients, and multiple studies, randomized controlled trials, some of these studies, they have a scale and they are rating quality of life. And one of the major percentages that we see improvement is in quality of life. We have to remember the quality of life is, if there is an oncologic patient with a terminal cancer, medical cannabis will help to improve the appetite, also will improve the sleeping quality, also will help the patients to feel more relaxed and deal with anxiety and depression. So even epilepsy, the children that are being treated with cannabidiol, you see a reduction also on of course, on the crisis, but you also see a very big impact on the family, not just on the patient, on the family, because if it's a child that is reduced 40 or 50% the seizure, this is a mother that will be able to go to work, and this is a family that will have more time to do other things together. So I think medical cannabis impacts the quality of life, not just of the patients, also of the family. So that's why I think cannabinoid medicine, I said, is the medicine of the future, but it's already the medicine of the present and was the medicine of the past. So I think that the doctor should be more open to this alternative, and should be in the toolbox of each physician or healthcare practitioner.
Well said. I mean, it's just, maybe I have a conflict of interest there, but it amazed me. Nevertheless, it's very well said. What can people expect when they visit a cannabis doctor? What's the process like? Now, you have touched upon this already, but perhaps you could amplify a little bit.
Yes, well, particularly in Colombia, that we have our clinics. It's a very simple process. Of course, the appointment, the patient comes to the consultation, the doctor does a clinical history record with a questionnaire or different history records that the patient can have. Then the physical examination, and sometimes as doctors, we like to have some preliminary blood tests. In another cases, in the same consultation, the doctor prescribes. In Colombia, particularly, doctors are allowed to prescribe medical cannabis. So what I do what we do in our clinics is we prescribe the medical cannabis in a form of magistral formulation. That is what is legal right now in Colombia. And the patient will receive the medication 3 to 5 days later. After that, particularly in my case, in our clinics, we do for the first month a follow-up on the patients every 3 days. We talk to the patient, the doctor, the nurses to see how is the patient evolving, because it's the process of titration. And then after a month or after the patient achieves control of the symptoms, then you start seeing the patient every month, every 2 months, or every 3 months, according to the pathology or the necessity of the patient. But it is a very simple process, and thanks God in Colombia we have this advantage that we have medicines available right now for patients.
Yeah, very true. A lot of places may have medical cannabis legalized, but probably actually accessing, like England, for example. But anyways, I won't go on about that. I understand the medical cannabis can be administered in several forms. Please describe.
Yeah, well, that's a very important part, because according to the country, you have different presentations. Globally, we know that the presentations where medical cannabis can be used is inhaled, of course, through vaporizators, that they are actually very good technology out there, and is the one that the patient will obtain the fastest effect, or the fastest relief, or the fastest onset of the treatment. Of course, I don't recommend the smoke part, because either way, the fact to be burning the cigarettes produce toluene, benzene, and different chemicals that can irritate the lungs. Another presentation is the oral presentations. We have tinctures, oils, capsules, sprays. So it's incredible what we have right now. And they are developing very interesting technologies, because we know that the oral presentations have a challenge, because the absorption is very little versus the inhaled administration. So with the oral presentations, I have seen very interesting things happening with nanotechnology, nano emulsifications, and different technologies that they're using to make oral medical cannabis having a better bioavailability and better absorption. And they are developing suppositoriums, patches, and of course the cosmetic line for doing treatments on the skin, and they're always using also technology for transdermal patches. So this is a very wide variety right now that we have. And then the edibles, that they are like the gummies and these other infused beverages that are not that much part of what us as doctors we use. So we use more in Colombia right now, we are just allowed to prescribe the oral medications. So as I said, we have tinctures, oil, sprays in magistral formulations. But so far in other countries, they have the inhaled way available. So those two are very important. Also, have been some good results reported with the use of suppositoriums. And in the cosmetic line, of course, the development of different types of cosmetic, which is very exciting too.
Yeah. Someday you'll have to tell people with a cosmetic line you developed for a very, very famous Hollywood couple. Anyways, let's move on. Tell us on an anonymous basis about a typical cannabis patient, one that you've treated. Give us like a quick case study.
Well, in our clinics, we see a lot of patients with chronic pain. This is huge because, as I mentioned, chronic pain is a big word, but we have to define what type of chronic pain. As I say, fibromyalgia, arthritis, neuropathic pain, oncological pain. But usually I have patients with fibromyalgia, a good amount that they respond very well. There were patients that they've been treated with a lot of different medications and even having all the side effects of these medications, particularly in this case, I'm talking about a female, 50 years old, that has been suffering of fibromyalgia all her life and being treated with tons of medications. And we know and we have evidence. Actually, Dr. Ethan Russo wrote a very interesting paper talking about the deficiency of the endocannabinoid system. So in these patients with fibromyalgia and chronic syndromes like fibromyalgia, irritable bowel syndrome, and migraines that are actually usually presented in patients with fibromyalgia, they found that these patients have problem with the endocannabinoid system. The tone sometimes are the enzymes that degrade the endocannabinoids, sometimes are the production of endocannabinoids, sometimes are problems with the receptors. So this is a very interesting theory. And in a patient, for example, with fibromyalgia, they respond very well to medical cannabis treatment, impacting their lives, particular lives of this patient. She couldn't sleep. She was all the time anxious and depressed, and she was all the day long suffering pain. And then by reducing the pain of a patient, that the scale was with the 1 to 10, 10. And then after a month, the patient reduced the scale from 1 to 10 to 2 or 3. This is, those are very big numbers because patients like this, then they sleep better, they eat better, and they have a better quality of life. So this is like a small example in here. And right now, where we have more scientific evidence in treatments with medical cannabis is refractory epilepsy, particularly Lennox-Gastaut, Dravet syndrome, and recently was approved for tuberous sclerosis, all the epileptic syndromes. And also for multiple sclerosis, particularly spasticity. Also, we have good evidence for the treatment with medical cannabis of patients with nausea and vomiting induced for chemotherapy. And the last will be chronic pain that I already described. So definitely we have a lot of patients with chronic pain being improving their lives by using medical cannabis. And I'm sure that we will see a lot of research being released very soon, and almost since last 5 years, I've been seeing a very important amount of research being released. So this makes me very optimistic because we know that we will have more evidence in the future for other pathologies that I think a lot of scientists and researchers are looking at for many years. And since the UN removed medical cannabis from Schedule 4, this is a way that the governments and countries can see that should relax a little bit the regulations they have for research, so that will allow more doctors to do more research. So I think the future is very bright for medical cannabis. I am very optimistic and I see a lot of applications, but I also see that we need to do more education, because medical cannabis can be more popular among doctors and healthcare practitioners if we keep educating doctors in a formal way.
That's great. Thank you. I'm going to have to wrap it up fairly soon, but there is one question I do have that I feel I have to ask, and that is, what problems do you see with medical cannabis? What are some of the side effects?
Very important. Particularly medical cannabis, you have to, as a doctor, we have to be careful with risk populations. There's populations that present high risk. For example, patients with unstable cardiac and pulmonary disease, also adolescents, and also pregnant women or during breastfeeding. And one of the most important ones is patients with clinical history of psychosis or schizophrenia. And also patients that they have a history record of substances or drug abuse. So those are risk populations that the doctor needs to assess what are the risk versus the benefits in these patients. Definitely, I will say that one of the biggest contraindications will be THC for patients with schizophrenia, because there's actually some studies right now with CBD, cannabidiol, for treating these patients, but THC avoided with patients with schizophrenia or psychosis. And what I was talking earlier about the drug-drug interactions, we have to think, and as doctors and scientists, we know there is a lot of interactions with other drugs, with other medicines that usually the patients are taking. For example, warfarin, some benzodiazepines. So it's not that there is a contraindication to use them, is that if the doctor is aware that the patient is taking these medications, there is actually a website where they have a very long list of these drug-drug interactions. So we actually have it available for our doctors, because it's impossible to memorize 50 or 100 medicines that could have interactions, because we know CBD acts in different levels of receptors, not just CB1 and CB2, acts on TRVP, or acts on 5-HTA, so many receptors that we have to account that other drugs or medications are using too, and also that they are all metabolized through the CYPs, the cytochrome enzymes.
Sandra, I'm sorry, sweetheart. I gotta wrap this up, okay? We're running over. So, thank you, Dr. Carrillo. I'll be home for dinner at 6. So,
Thank you.